The Affordable Care Act was first branded Obamacare by opponents. Then supporters said, yeah, let's call it Obamacare, because many of them feel it will be as important and eventually as popular as Social Security and Medicare. But for others, it is big government and big spending at its worst, and they are not about to give in. So there are hopes and fears and doubts and questions and decisions. And tonight we're going to focus on one of them, expanding Medicaid starting in 2014. It's a key component of the Affordable Care Act, and it's very likely that this year Missouri will just say no. Here's what the Affordable Care Act is designed to do: get as many Americans as possible under some kind of health insurance plan. And we'll start with why many consider that a really good idea.
So we know that when someone is uninsured, that they don't go for primary care.
But it doesn't mean they don't have things wrong with them. They're just not treating it.
We're spending money now, state money, to care for people in emergency rooms, to care for people in uncompensated care clinics, to provide mental health services.
But while there is general agreement that the health care system in America needs fixing, there are those who are just as convinced this is not the right way to do it.
I know where Missourians are on Obamacare. They greatly oppose it.
Here's what we're dealing with. Right now, about 60% of Americans from age 19 to 64 get health insurance through their jobs. About 6% buy it out of pocket. 13% are covered by public plans, mostly Medicaid. But 21% have no health coverage, public or private, and that population is the target of the new law. Starting in 2014, the uninsured who make above 138% of the poverty level will have to buy coverage on the new health insurance exchanges going online this fall, or pay a tax penalty. The Supreme Court has upheld that part of the law. Lower-income adults would be covered by expanding Medicaid. Here's how this would be funded. For the first 3 years, the federal government would pay the full cost of Medicaid expansion. Then states would start paying. By 2020, states would foot 10% of the bill. Estimates vary, but Missouri could end up paying $100 million a year and get $1 billion in federal funds. But here's why we're talking about this. The Supreme Court said Medicaid expansion could not be forced on the states, and that has given Obamacare opponents the opening they've needed, if not to kill it off entirely, then at least to stall implementation and possibly force some significant changes. Possibly.